Hello, my name is Dr. Kiri Chan. I'm one of the gynecologists at the Shepparton Women's Health Centre. Today I'm going to talk to you about menopause and 5 commonly asked questions about the change of life. So, some weeks ago, Dr. Margaret Stegman spoke about the ovaries and what they do. As she explained, the ovary has 2 primary functions, which is one to release an egg, and secondly, to produce the female hormones estrogen and progesterone. So, what is the menopause? The menopause is when the ovaries stop working and run out of eggs. The hormone levels drop down, and in fact, it's the low estrogen that causes most of people's menopause symptoms. Most women will have some symptoms, and the average age of menopause is about 51. And on average, menopausal symptoms last for about 8 years. Of course, there is menopause that happens at the natural time of change of life around 51, but also can occur earlier if somebody has surgery to the uterus and ovaries, chemotherapy, or radiotherapy for cancer treatment. 1 in 10 women may have menopause before the age of 45, and if it occurs before the age of 40, we call this premature ovarian insufficiency. So many people ask how you know if you're approaching menopause. Well, one of the most common things that happens is that people notice period changes. They can get more frequent and heavy, troublesome periods, or women can have lighter and less frequent periods. Some women experience increased mood changes and feeling very irritable or changing moods, swinging moods all the time. Some women also experience hot flushes that can be problematic either at night or in the day or both. There can also be subsequent sleep disturbances, problems with intimacy due to vaginal dryness and irritation, worsening bladder symptoms, such as increased bladder infections or other bladder discomfort. And a lot of women tell me that they get weight change during the menopause, but the studies seem to show that it's more related to a change of fat distribution at the menopause, going from the hips towards the abdominal region, rather than an actual weight gain in itself. And weight changes often do occur, mainly related to lifestyle changes that occur around this time of life. So many women ask how they can improve their health during the menopause. There are some very basic general health prevention things that women can do to improve their health. Some of the simplest things include having a healthy, balanced diet, participating in regular physical activity or exercise, and sometimes this simply means being more active, choosing to take the stairs over the lifts, but also structured, planned, regular exercise. And in particular, if of course, walking and cycling, these can be really good for heart health, but particularly for bone health, which is an issue at the menopause, as the bones do start to get weaker around this time. It's particularly important to be engaged in increased resistance and weight-bearing exercise, such as jogging, hopping, and skipping. These will help increase and strengthen the bone remodeling and optimize your bone health from the menopause. An appropriate amount of sunlight or vitamin D is very important for bone health as well. Of course, in Australia, there is a very strong sun, and we need to be very cautious about excessive sun exposure that is unprotected with sunscreen due to the increased risk of skin cancer. But there is a lovely website in the Osteoporosis Australia that details the kind of sun exposure that is recommended. and different times of the year and for different types of people with different types of skin. Stress reduction is also a lovely thing to try to do, if possible, and certainly avoiding smoking, taking caution with alcohol are sensible things to do. We also recommend seeing your GP at least annually for routine heart screening, things like your blood pressure, cholesterol, diabetes monitoring, but also not to forget regular cervical screening testing, which is every 5 years, and mammograms, which can be done every 2 years or more frequently if there is a need. Many women ask whether there are natural treatments that can help with hot flushes. Certainly, to start with, there are many women very anxious about taking a medical treatment such as hormone replacement, and so many women ask about whether it's okay to take natural treatments and if there are things that do work. Sometimes there are simple lifestyle changes that can help. For mild symptoms, certainly, one little trick is to dress in layers of clothing and be able to remove the layers as you feel the temperature rising with a hot flush. Other things that can help might be bringing around cool drinks, cold packs, a portable fan, staying in a cool room. Also, some people find that avoiding foods that might bring on the symptoms, such as alcohol or caffeine and spicy foods, can be helpful. Now, a lot of people are interested in over-the-counter options, and there are many so-called complementary or alternative therapies that are very popular for hot flushes. Some are soy-based, some like wild yam cream, progesterone creams, but it's important to realize that there isn't a lot of evidence to back these up, and the safety is sometimes unclear, especially if there's any history or risk of breast cancer. It's generally better to avoid soy-based products, which have phytoestrogens that are similar to estrogen. Although bioidentical hormone therapy is marketed as more natural than HRT or hormone replacement therapy, it is not necessarily so. And generally, if it's not appropriate to be on hormone replacement, one probably shouldn't be on bioidentical hormone replacement either. There is some weak evidence that vitamin E and black cohosh may help with very mild hot flushes. And certainly the studies do show that things like hypnosis, cognitive behavioral therapy, mindfulness-based stress reduction can help. There is a little bit of research that shows acupuncture might be able to help, and there's some mixed reviews over yoga and whether that can help. The key thing is to seek out qualified and experienced practitioners, and it's often very helpful to speak to your GP to make sure you're making the right decision. Finally, many women ask whether HRT is thought to be safe. Now, as low estrogen causes most symptoms of menopause, hormone replacement actually supplies estrogen, so it is very effective at treating menopausal symptoms. This can come in forms of a skin patch or a gel, tablets that you take by mouth, or vaginal estrogen as well. Women are recommended to take estrogen alone only if they have already had a hysterectomy or removal of the womb. However, if your womb is still present, progesterone is needed alongside the estrogen in order to protect from womb cancer. Now, coming to the question of whether HRT is safe, generally it is said that the benefits are greater than the risks up to the age of around 60 years of age, but it does require individual consideration. If you are a woman who has had early menopause, it is recommended that you take it until the average age of menopause, which is 51, and that is generally very safe to do so. I'll talk about some of the benefits and risks. So first of all, with the benefits, most women For most women, HRT is safe if it started in the first 10 years after natural menopause. And it proves, there's proven evidence that, there's strong evidence that it improves women's menopausal symptoms, it improves women's bone density and reduces the risk of fracture. It certainly doesn't cause weight gain and may help to prevent weight changes. However, there are risks of taking hormone replacement. One risk is the risk of clots in the legs and lungs, or venous thromboembolism. For example, if you take a tablet estrogen and progesterone hormone replacement, your risk of getting a clot is double that of somebody who doesn't take this. But in absolute numbers, this equates to 1 extra case per 1,000 women. So overall, the risk isn't very high, and the risk is certainly even less if you use topical hormone replacements such as patches or gel. Now, with heart disease, there seems to be evidence that the risk of cardiovascular disease is not increased if a hormone replacement is taken within the first 10 years of menopause. And in terms of breast cancer risk, studies do show that estrogen and progesterone do increase the risk of breast cancer, particularly after 5 years of usage. And in absolute numbers, this translates to 1 in 1,000 women after 5 years of treatment. There is some evidence that careful selection of a progesterone, to choose a natural progesterone, may carry a lower risk of breast cancer. And if one has had a hysterectomy and is able to go on an estrogen-only hormone replacement, there seems to be less of a concern with increased risk of breast cancer, relatively. Now, certainly for women who are not able to take hormone replacement or are unwilling to take hormone replacement or not keen to take it, there are other medical non-hormonal options that are available. And this can be discussed with your GP or your gynecologist. Generally, medical treatment of menopause should be individualized, taking into account many factors of a woman's health history, for example, previous breast cancer, family history, and other health conditions. If you have any questions about this, please do see your GP or a gynecologist experienced in the treatment of menopause to discuss this further.